Despite enduring the COVID pandemic for a year, there are still multi-trillion-dollar questions the world needs answered. Most importantly, how and why it began. Up until now, China has been reluctant to help, hindering efforts to find out the truth about this disease. But finally, a few weeks ago, the World Health Organization was allowed to send experts to Wuhan to investigate. And there was almost instant and significant progress, including from an Aussie doctor on the team who was able to contact and interview the first known case of COVID-19. The central Chinese city of Wuhan, COVID-19's ground zero. And it's now the focus of the highest level investigation into the origins of the virus.
How's the trip going?
Precisely where and when did it make the jump from animals to humans? Some people have compared your investigation to a homicide detective turning up to a murder scene a year later. Does it feel a bit like that?
Well, look, in the ideal world, you would do the investigation as the cases were appearing, but nobody can do that. So, look, it is difficult to go back and do things in a retrospective manner, but that's all you can do.
Professor Dominic Dwyer is a microbiologist and infectious diseases expert. The only Australian among a 15-strong team of scientific sleuths from the World Health Organization. For more than a week now, they've been piecing together an enormous pandemic puzzle, visiting key locations including Wuhan Hospital, the Bat Lab at the centre of COVID conspiracies, and combing through the city's infamous wet market.
Everybody knows that the market allowed things to spread. And we visited the market, and it was very easy to see how things could have spread in that environment, no doubt about it. But whether the first patient was there or whether someone had been infected beforehand and come to the market is actually the key issue here, and that's what we're trying to sort out.
In a bid to answer that question, the team has traced the earliest cases, going back as far as the beginning of December 2019, leading to a remarkable face-to-face meeting between Professor Dwyer and the very first reported victim of COVID-19. It sounds like that is, for now, the patient zero.
Yeah, I think the Chinese authorities believe he's probably the first patient, so patient zero. But I think one has got to do a little bit more detective work to be happy that that's truly the case.
It's pretty extraordinary that we've got a disease that's infected 100 million people worldwide, and you've sat down with what could be the very first case.
Oh, well, that certainly crossed my mind on speaking to him and asking him questions. So it was really quite a moment to have that discussion, thinking this person may well be number one.
What the meeting also raised was a bombshell, one that challenges a key assumption about the virus. In terms of age, sex, or level of illness suffered, what can you tell us about this patient zero?
Look, I don't know that it's fair to discuss his details because he can be, I guess, identified. And to be fair, from the privacy point of view, I wouldn't do that. But to be honest, just an ordinary person. There was nothing dramatic in his background or history or activities that gave any clue as to where this might have come from.
Did he work at the Wuhan wet market? Did he visit the market?
Well, this is the interesting thing. He actually didn't visit the market. So whether he got it somewhere else from somebody who didn't know they had it, who themselves might have been at the market, we don't actually know that yet. And so that is perhaps one of the really key points of the whole mission.
It's hard to imagine a more politically sensitive or challenging mission, coming as China continues to reject accusations it downplayed the severity of the outbreak in those critical early days.
All along, we have acted with openness, transparency, and responsibility. We have provided information to WHO and relevant countries in a most timely fashion.
But there is now mounting evidence of a cover-up. Do you think China's been honest and upfront since the beginning of this outbreak?
It's obvious that if we look back to the beginning of the outbreak, that Wuhan health authorities were trying to downplay the significance of this outbreak. They emphasized that there was no evidence of human-to-human transmission. But later on, when we go back to the data, it's very obvious that since the beginning of December, there has been human-to-human transmission in the city. And there were also hospital outbreaks in several major hospitals in Wuhan.
Dr. Yi-Chun Lo is an expert in controlling infectious outbreaks based at Taiwan's Centers for Disease Control. Given its proximity to mainland China, Taiwan has remained hyper-vigilant since being caught off guard by the SARS outbreak in 2002.
We have been preparing for such outbreaks like SARS for almost 18 years. So we kept high-level alert about any official or unofficial information about disease spread in China.
It was early on the morning of December the 31st, 2019, when Taiwan became one of the first countries to pick up reports of a new SARS-like illness posted on social media by doctors in Wuhan. For weeks, there had been a growing number of patients presenting with severe pneumonia. The doctors were deeply concerned, but immediately shut down by Chinese authorities.
Later on in the afternoon, about 1:30, Wuhan health authorities released that first press release saying that there is an outbreak, but there was no human-to-human transmission, and it's not SARS or it's not coronavirus. So I think that from day one, Wuhan health authority was not honest and was trying to hide important information.
By early January, Wuhan hospitals were rapidly filling up with COVID patients. Critically, health workers themselves were contracting the virus, a clear sign of human-to-human transmission. But China was still giving nothing away.
And later on, even during the second week of January, between January 12th to January 15th, when we sent two experts from Taiwan to visit Wuhan, still those information were not provided.
Doctors from Wuhan, their identities carefully hidden, have now confirmed they were ordered to keep quiet.
We knew the virus transmitted from human to human, but when we attended a hospital meeting, we were told not to speak out. Provincial government leaders told the hospitals not to tell the truth.
Gagging health workers was just one of the ways China masked the scale of the unfolding pandemic.
The police will deal with the illegal spreading of rumours. Disruption to social order won't be tolerated.
Even after the outbreak was occurring in Wuhan, they were reporting to WHO and to the world that there was limited or no person-to-person transmission, what we call community spread. That was patently untrue.
It's very sad.
Professor of Global Health Law Lawrence Gostin has been a senior advisor to the WHO for 3 decades.
Not only did China not transparently report that to WHO, but it actually withheld it and gave it wrong information. As a result, people like me were reassuring the world that we're okay. And that turned out to be completely false, and I think verifiably false.
It does now seem scandalous that nearly 6 weeks after the first cases, and with clear evidence of human-to-human transmission, that state-run media in China was still reassuring people it was safe.
Half a month after the official notification and release of information, we can begin to relax. No clear human-to-human transmission has been found.
And so millions of Chinese headed into the Lunar New Year celebrations oblivious to the unfolding disaster, spreading the virus throughout China and further afield. To call it negligence on China's behalf seems almost kind. This was something much more sinister.
Yeah, I mean, China had a political purpose behind it. And so I think they didn't cooperate just as a matter of national prestige, both to get their own inhabitants to buy into the government's popularity, but also internationally.
So put simply for China, though, this was a matter of pride and saving face.
Yes, it was a matter of pride and saving face and projecting prowess and competence in the world.
The rest, of course, is history. Now, the World Health Organization is trying to make sure this never happens again. Seeking answers to the most important questions, it's forced to rely on cooperation from the very officials who deliberately kept them in the dark. Do you feel diplomatic pressure, political pressure in what you're doing?
Look, to be honest, we try to put that aside. I mean, we're all obviously aware that there's a lot of pressure on the results and so on, but I think the scientific aspect is really the key to focus on and leave the politics, to be honest, to other people.
Do you think if China had been honest, open and proactive from the outset, that this whole global pandemic could have been avoided?
Yeah, I think the pandemic could have been avoided if China was honest and transparent about what's going on in Wuhan in December and early January. Yeah, that's my belief. If the politics in China doesn't change, public health officials are not empowered to tell the truth without political interference, then this kind of tragedy will happen again.
Hello, I'm Tom Steinfort. Thanks for watching 60 Minutes Australia. Subscribe to our channel now for brand new stories and exclusive clips every week. And don't miss out on our extra minutes segments and full episodes of 60 Minutes on 9now.com.au, as well as the 9Now app.